Thank you, Dr. Dzugan. Welcome back as we answer a few more questions from our members about COVID-19. Dr. Dzugan, to retake on the discussion in the last video, you talk a lot about lifestyle as well. What general guidelines are you abiding by right now? What should we implement in our own lives to help stay strong through these COVID-19 time?
First, just few general things. Like I always said, don't panic. There is no reason for panic, and all problems that currently we have because video created a lot of hypes on this coronavirus, and we have problem because a lot of talk about this negative thing. Second, don't buy all toilet paper in your Walmart or Walgreens, and don't buy a lot of food because it looks like you will throw away your money. It's just general things.
That's good advice.
Serious thing is don't avoid your exercise. Only one thing that I think we need to remember that we do not need to create problem to our body, and we need keep our exercise in some moderate mode. So no heavy exercise, because if you will tired and you will recover slowly after damage from exercise, you can hurt your body more than you'll get help.
So how do I know that I have the right amount of exercise that I'm doing?
I think you need to do approximately 45, 60 minutes of moderate exercise. So no heavy lifting, some small weight, higher frequency exercise. And the best way for people like my age, so the best way, we need just walk. Maybe 2-3 miles per day. It will be good for prevention. Also, some typical recommendation: we need to avoid any kind of extra contact with our lovely animals like dog, cats, because it can be additional problem for parasites and some possible not clean environment in our house.
Okay.
Regarding what we can do for improvement of our health, like we talked previously, what we need to do, we need to keep our body foundation in stronger shape. So we need to use some basic supplements that will help you keep your immune system stronger, and plus use very specific supplement that normally we use for stronger immune disorder conditions. And we talk last time about the supplements.
You talk about not to panic. If I'm now from nature very stressed out and nervous, is there anything I can do to help level my stress and get to that calm state that we're supposed to be in?
Of course. Clients that already use our program, they usually have much less level of anxiety and panic attacks and depression. But there are specific supplements that can help with this condition. It can be some not prescription hormones like pregnenolone, DHA, 7-keto DHA, or it can be some supplements like valerian root, L-theanine, magnesium, 5-HTP. So it's different supplements that normally we use for any kind of mood disorders.
Okay.
But like I said, if you will, unfortunately, missing information is a problem, because what we try to do right now, media tries to do, they try to show just one side of this virus, but they didn't tell us how many people died from regular viruses. Nobody told us that approximately 2 different coronaviruses are known for decades, and they usually part of regular flu season. Mm-hmm. Of course, they not so strong like SARS that we have previously, they a little bit weaker than this one, but this virus is not so strong like it was previously. But again, media take so strong action, and they try to work on people.
Getting us worked up.
Yes. So again, I do not try to say that we need underestimate this virus. Of course, we need to do prevention. We need to take supplements. We need to wash hands. Only I am completely against recommendation like people said I need to wash my hands all the time, because you know that every time when you do cleanse of your hands with strong chemicals, you will remove your natural flora from your skin, and you can get any kind of dermatitis or any kind of weakness or sickness or diseases of your skin. That's why we do not need to be crazy about it. Like I said, we need to take seriously, but we do not need to be crazy about it. So it's same thing. Like I remember, I am a retired heart surgeon, and I remember that some people recommended like you need to drink like 10 glasses of water every day. I mean, if I have especially heart condition and I will drink such volume of fluids, I will be like balloon, and I will have higher blood pressure, and I will have some heart insufficiency. So we need to be very careful with all this recommendation, and again, we do not need to hear just one side of story. We need to hear other side of story.
Okay, so in general, I take from this, if I go into public, what is your take on wearing a face mask or gloves or protecting ourselves that way?
I do not think that you need any specific surgical gloves, but definitely because many people touch at different places that you can touch. So in the store, probably the best way, you can take maybe spray with alcohol, and after touch cart, you can spray alcohol on your hands, and go back to your home. Okay. And with mask, most doctors do not recommend use mask for healthy people, and they recommend it to use mask only for people who are sick. So this way, you immediately will recognize who is sick, so you will not be close to these people. And second, you can prevent any kind of infection because contact with this person. Because with this coronavirus, nobody knows exactly what transmission way or transmission way of this virus. I mean, there's some discussions, but we do not know for sure.
All right, wonderful. Well, thank you so much for your time, Dr. Dzugan. And
my pleasure, Andrea.
We will be talking soon, and stay healthy. The best
Thank
to you and
you.
the family.
Thank you, Andrea. Thank you.
Talk
Bye-bye.
soon.